Hi everyone, my name is Dr. Ganesh Veerabhadraya. I'm a consultant neurosurgeon, brain, spine and neuroendovascular. Today we will know about MLD, micro-lumbar discectomy A to Z. We'll know everything about micro-lumbar discectomy. Micro-lumbar discectomy, it's a spine surgery. It can be done by minimally invasive or open. Both are possible. Microlumbar discectomy, it is advised in very severe degenerative disc diseases, most commonly L4, L5 disc prolapse, or you may call L4, L5 extruded disc or disc extrusion. All these are the different names. Most commonly, it will present those who presents with a sciatica, severe low back pain or radicular pain, which is going to the right leg or left leg. These people will not be able to stand, sit, or move from one place to another place. There will be a severe pain going from hip to down till toe or sometimes knee. Most of the time, these people may be suffering from bad posture or maybe working profession who sits for long period of time, or they may be taking medications for the back or sciatica for so many years. It may have there may be difficult to get rid of the pain. This pain sometimes aggravates on cough or sneeze. Then doctor, after examining, he may have seen the disc which is prolapse, which is pressing the nerve root very severely, compromising the foramen or nerve root. Maybe it is causing damage to that if further continuation of any form of treatment of medical or alternative treatment. At that time, after seeing the MRI, magnetic resonance image. This is a gold standard for any spinal problem. MRI will indicate, it shows clearly the cause of the sciatica, the disc prolapse or herniation or extruded disc. At that time, your doctor will advise micro-lumbar discectomy after evaluating with a series of tests, maybe X-ray like flexion, extension X-ray, anterior-posterior or lateral X-ray may see, image. Sometimes if it requires, he may advise CT scan of the lumbar spine. It is after seeing everything, you may have advised micro-lumbar discectomy surgery. And also doctor may have discussed with all the options like minimally invasive spine surgery or open laminectomy or discectomy. Before going for the procedure, it is wise to know all about microlumbar discectomy surgery, when it is done, how it is done, what are the complications involved, and what are the risks involved, what are the benefits involved. All this. To brief about this surgery, it is presently it is done like a daycare surgery. That means very short stay. It is not like so many years before, ages before, around 10 or 15 years or 20 years before. Nowadays, with recent advances, recent technology, micro lumbar discectomy or any spine surgery now is much it is safer compared to our earlier days. Once this surgery is advised to all our patients, will tell if any blood thinners are there, they have to stop at least 5 days prior, or you should stop smoking. Any hypertensive medicines, sugar medicines, they have to sugars means they have to control the sugar levels before undergoing the surgery, or because the chance of infection will be there if not controlled. And hypertension medicines they have to take properly. BP should be well controlled. blood thinner should be stopped, because on the surgery day, it will, if the bleeding is very severe, it will causes problem. So all these things, and before the surgery, will even take the physician opinion and cardiology opinion and anesthesia opinion before undergoing the surgery. Once we everything is fine, we'll admit. Suppose today morning is the surgery, we'll most of the time we'll ask them to admit one day before surgery, or sometimes on the day of surgery, early morning they will get admitted. And then this microlumbar discectomy surgery is done usually under general anesthesia. Hence, all this pre-operative checkup or workup is required. We'll do all the blood investigations and relative investigations. Then, once fit, and also at least 6 to 7 hours before the surgery, if you are undergoing general anesthesia, one should stop eating or drinking so many hours before surgery. Otherwise, while giving anesthesia, the complications like pneumonia will be there. Hence, will all the people who are undergoing general anesthesia will stop taking food by mouth, or will tell NPO, nil by mouth, or nil oral. Once this is done, this surgery, suppose microlumbar discectomy, if it is advised, at what level it is involved, it is very important to know whether it is L4, L5 disc prolapse or L5S1 disc prolapse. It is we have to localize that, means identify the region. Hence, once the patient is taken to the operation theater, after giving anesthesia, we'll make them sleep on the back with the special bolsters or soft pads. Sometimes we may, most of the time for microlumbar discectomy, we will not put any urine catheter or called Foley's catheter. If any pre-existing problems are there, we may advise based on you. In the back, we'll clean everything, and we'll localize, identify the region where there is a disc prolapse like L4, L5 or L5S1 with a special C arm. Through the X-rays, we'll localize that, and then we'll identify, clean, and then once we identify, either microscopic microscopic discectomy or endoscopic discectomy can be done, and most commonly we minimally invasive small incision surgeries like tubular, these things we will do, and open also we will do when it is indicated. Once the structures, whatever is there, we will retract and identify the area, the micro nerve root, whatever the nerve root which is pinching, which is separated, and will clear all the discs which is involved, like L4, L5 disc will be cleared, and nerve root at the end it will become free. Then we will close, and we'll put melting sutures most of the time for only single level or one level L4, L5 discectomy, if it is planned. Once it is done, we will reverse from the anesthesia by our anesthesiology colleagues. Then we'll ask, once they recover from anesthesia, we'll ask them to move the toes, feet, legs and all to check everything is fine. Then on the once everything is fine, after observing in the ICU for a few hours, we'll be shifting the patient to the ward, and evening we'll make them to walk. Once they walk, they can go on the same day or next day. Most of our patients on the same day will discharge, or sometimes next day also will discharge, depending upon the pain tolerance. Some medicines like antibiotics or painkillers has to be continued for a few days in the beginning. Yeah, probably 2 to 3 days of pain medicines may be required. Once this is done, after 1 week of the surgery, we'll call for the follow-up to see how you are, any new problems to be addressed, or want to clarify all these things, to check the wound. If you have put the staples or stitches, it has to be removed. If not, it's not required. And all our patients will ask, sometimes will put the like a waterproof dressing. We can ask them to have bath, or if not, we'll ask them to not take bath for some days, and then once wound is fine, we can they can have bath. Once this is done, we'll advise not to bend forward or lift heavy weights for 2 to 3 weeks of the surgery. After 1 month, slowly they will get back to normal. And most of the people who have undergone microlumbar discectomy, they can join back the work in 15 days to 3 weeks, depending upon the pain tolerance. Up to up to 4 weeks, they will advise them not to do any kind of vigorous exercises, except walking in their house, or in the park nearby, or they can climb down the stairs even after the surgery. 1 day or 2 days after the surgery, we can ask, they can engage in most of the activities, except bending forward or lift heavy weights. Then once 1 month is over, after 1 month, we'll call for the initially follow up will be 7 days. Next will be 1 month follow up. Next it will be 3 months follow up. Then 6 months. Then every year. Once 4 weeks are over after the surgery, microlumbar discectomy, will teach them isometric lumbar exercises that strengthen the ab muscles and back paraspinal muscles. This will helps to prevent adjacent level disc prolapse, or it helps to strengthen the muscles of the paraspinal muscles. Those who have undergone surgery, the paraspinal muscles will become strong by these isometric lumbar exercises. This how microlumbar discectomy goes from day one to almost day 7. Then after 1 month, after 3 months, after 6 months, after 1 year. To brief, if this microlumbar discectomy nowadays, it is safe because of the infrastructure like microscope, drills, and micro instruments, and skilled hands. Hence, whenever the microlumbar discectomy surgery is advised, no need to get scared. Please take the help of your doctor and expert, and ask them the complete details about the surgery, the road to recovery. You can reach us if you need. Thanks for watching. Have a nice day.